Hey guys, so just to kind of wrap some of those little final pieces up, I just wanted to talk to you about a few different details as far as taking into consideration cultural implications when we're making specific diagnoses, and also just how we're determining certain things. So, when we're looking at all of those things and we're taking in all of those cultural things, we're describing certain aspects. And when we're looking at how cultural norms may affect certain things, we want to make sure that the family identifies with certain things, and we don't really want to stereotype anything. We want to describe how to properly work with and address certain factors. So when I'm working with a client, I really want to know and be able to address their ADHD symptoms. And I want the family to know how they can help them, because a lot of times what we realize as therapists, it's the work is done at home. So we're meeting with them, and if the family is unaware of what I'm working on, then it's going to be difficult to make sure that those types of things are assessed and they're paid attention to. So that's one of the most important things. In order for me to address my client's symptoms, I utilize an intervention plan that combines certain elements. So I use a combination of bibliotherapy, hip hop spoken word therapy, mindfulness therapy techniques, and then that focus is mindfulness. And in order to provide the client and their families with that foundation of acceptance when trying to deal with these symptoms, I utilize the mindfulness, and I basically look and see what kinds of symptoms the child is exhibiting. And a lot of times, in just talking to certain children, some children are able to focus for a longer amount of time. So depending on how long that they're able to focus on something, that's going to determine what my approach is. And so when I'm taking a certain approach, what I like to do is make sure that my child has the capacity to understand certain things. And if they don't, then I'm going to break it down in different ways where they can understand certain things. So if I'm working on a mindfulness meditation technique, I want to make sure that they're able to grasp that. And some children, they're able to sit down and breathe in and out. And then there's other children where I'm going to have to get a little bit more creative with teaching them that mindfulness technique to help them focus and to help them lower and decrease some of those symptomatic behaviors. The combination of the other therapies that I mentioned, that falls hand in hand with the mindfulness and with the bibliotherapy and the hip hop spoken word therapy. They're kind of able to creatively put into their own words how they can decrease their own symptoms, even if they might not necessarily understand what's happening to them. You kind of break it down in a way that they can understand it, which is very, very, very important. And some children with ADHD, they're able to sit down and look at it and be able to not have as much extra creative things that are going on. And then there's others where I'm going to be using a lot of therapeutic sensory items to kind of reiterate those breathing techniques, those taking account of this is what my emotion is in this moment, and this is how my family's reacting to me. When I'm looking at referrals and who I'm going to refer out, basically I look at figuring out whether or not the child is going to need a psychological evaluation. Sometimes, as a depending upon what your expertise is, what your education level is, and what your licensures and different things like that, you may not have the ability to go into different examinations. So I would look at referring them out to a institution or an agency or a psychiatrist or a psychologist that can perform those psychological evaluations, as well as referring them out to primary care physicians or pediatricians that specialize in assessing certain ADHD symptoms, in addition to what they've already learned thus far. Another thing that I'm trying to determine and that I want to be aware of is ethical considerations. And as I've mentioned before, the ethical situations are going to be the cultural norms and kind of what the family abides by, as far as, you know, do they abide by the cultural norms or societal norms, or are they choosing to do something different? And I think that's going to be very important when you're trying to interpret how the family feels about the client's ADHD symptoms, whether or not they view it as a disorder or not, or whether or not they view it as the child being disobedient. Hopefully this shed a little bit of light on how to deal with ADHD symptoms. Thank you.